Hello, it's Dr. Rhonda Johnson, and today is Wednesday, December 23rd, 2020. Well, folks, the new super contagious coronavirus is on its way, if not already here. Well, you've probably heard that the virus has mutated. Truthfully, since we discovered this virus and the genetic blueprint was revealed by the Chinese, more than 4,000 new mutations in the coronavirus have been discovered. Now, most of these mutations are in the spike protein, and that's important because the spike protein is what allows this virus to attach to the human cell to get inside your body and replicate. As I've said many times, to this SARS-CoV-2 virus, the one that causes COVID-19, our bodies are its food. Or if you don't like to think about it as food, along with the season of the holidays, think of it this way. Our bodies are the ultimate Christmas present for this virus. So this new highly contagious strain has accounted for more than 60% of the cases in London. Now, it also appears to be causing a higher viral load in the nasal swabs of people who get tested. And more viruses in the nose means that whenever you sneeze, more viruses get released. And that's how this infection becomes so contagious. This new mutant virus appears to be spreading very, very fast. And scientists in the UK have determined that it is 70% more transmissible than previous strains of the coronavirus. The scientists in the United Kingdom have also discovered that children may be more likely to get infected with this more contagious strain. They are seeing it in the data that they're analyzing. Now, keep in mind, in the United Kingdom, children have been going to school all along with full classrooms, and they're not wearing masks in their schools. Now, folks, the big question is, should we be concerned? Well, the answer is, of course. Should we panic? The answer is, of course not. In the end, how quickly the virus spreads depends on many factors. And one of the most important factors is human behavior in a given community. That important behavior is, guess what? You know the answer. Wearing the mask, physically distancing, washing your hands, and avoiding large gatherings of people. It's just that simple. So my advice is just to assume that the virus is here and do the very best that you can to practice prevention. Folks, until we get the COVID vaccine, it's all we have in our fight against this coronavirus. I encourage you to be making your mind up about the coronavirus vaccine. Folks, I know this pandemic is wearing on our last nerve, to use the common expression. People are disheartened, they're overwhelmed, they're mad at the public health officials, they're mad at the government, they're mad, period. Please know that there is hope. Even with this new strain of the highly contagious virus, the vaccine should still work, experts say. And the vaccine manufacturers are actually testing their vaccines against this highly contagious strain. Folks, hundreds of thousands of people now have gotten the coronavirus vaccine in the past 2 weeks. For me, this is what hope looks like during this pandemic, a vaccine. We know that in natural environment, natural selection tends to make viruses more contagious with mutations, but human behavior drives transmission. So folks, wherever you are in the world, And I know that people watch my videos in the countries that I've done missionary work, in Haiti and Brazil and Kenya. Please limit your exposure to other people whenever possible. And of course, always wear your mask when you're outside your house. You know, we're in this together. This is a global pandemic. Let's do everything we can to stay safe and stay alive as we wait for the vaccine. And lastly, Christmas is just 2 days away. I want to wish everyone a very safe and a very Merry Christmas. Have a blessed day.